Good afternoon, everyone. Thanks for joining us on the media briefing for this Wednesday. We have a very full agenda, so we're going to go ahead and get started. We're going to start with the topic of agricultural worker protection. And Monterey County really was among the first to consider the protection of our farm workers when the pandemic began. And that work is continuing. And I'm very pleased to have Supervisor Luis Alejo with us today and Kim Stemler, who's the Executive Director of the Monterey County Vintners and Growers Association, to talk about the continuing work on protections. Good afternoon.
Thank you, Maya.
Supervisor Alejo, can you lead us off and talk about kind of how the protection got started and why it's still continuing today?
Well, first of all, Maya, I think we all recognize that the Salinas Valley, Monterey County is one of the most important ag regions in the nation. And I think our county has also demonstrated being a real leader when it comes to raising concerns about the protections of agricultural workers. We were the first last March 20th to issue the first advisory on the protection of farm workers in the nation, but we were the first to advocate for PPE, priority testing, and most recently priority vaccination for farm workers. So I commend that that's been a partnership not only with the county, but with our ag employers and also our ag labor unions and community groups. Supervisor Lopez and I are part of the County Ad Hoc Agriculture Committee. This allows us to have ongoing dialogue almost each week with agriculture on issues during this pandemic and even during the 3 wildfires last summer. But I think we all recognize that the new season was upon us, as we know that it will start next month. And not only will thousands of local agricultural workers return to the workplace, but we also know that thousands more will begin migrating back to our area from places like Yuma or Imperial, or if they're H-2A workers from Mexico. So we thought it was incumbent upon us to be ahead of the game, to start planning, to start having dialogues, and to refresh these protocols that we think will better protect agricultural workers during this upcoming harvest season. And I think a lot of work and thought went into this, and it covers a wide range of issues from resources for testing workers as they return, what to do when workers get sick, but also the alternative housing and wage replacement programs that we have, and also reminding folks about plans for transportation of workers in the bus. So I know Kim Stemler is going to go into a lot more detail, but again, this is an ongoing partnership with agriculture, and I think it has really helped us bring down the infection rates that we had seen last summer. We know that we're at a low because of the season had ended, but we hope to keep that these protocols will help us keep infection, hospitalizations, and death among agricultural workers as low as possible. So I'll pass it over to Ms. Stemler.
Yes, and Kim, if you would go into a little bit more, you gave a presentation at the board yesterday, but there was really a lot in that protocol that the industry has been working on.
Yes, thank you. So the ag industry has really extensive safety regulations, probably more so than most other industries because of the food supply, right? And early on, we found that we didn't have the leadership nationally or in the state to guide us into what healthy practices would be. So we as a whole, very much appreciate the leadership of Supervisor Alejo and Supervisor Lopez and bringing us together and creating these protocols. And it's a true partnership, and we continue to work in partnership with the ag organizations, with the county ag commissioner, and with the supervisors. And also we often work with labor unions as well. That's a nice thing to know. So the big buckets, and the one that we're thinking about a lot right now is around testing. Even though our minds are on vaccinations and they're available, they're not going to come in quickly enough. We have about 15,000 people coming in from out of the county over the next few months. And we add that to the 40,000 that are already in the county. The majority of them are working, but there are some that are not, and they will come back to work. So it takes a long time, particularly at this trajectory of vaccination supplies, to get 55,000 people vaccinated. So we need to continue thinking about testing. This is not something new for the ag industry. As I mentioned yesterday, back in May and June, it took me 23 days, as I'm sure a lot of you had the same experience, from the time I got the appointment to the time I got the results of my test. So very early on, ag realized they could not survive. They could not run effective businesses if that's all they relied on in testing. So they looked for other alternatives. And the ag trade organizations were actually doing a lot of research and partnering with other regional associations throughout the state to try to figure out solutions. Then what we came up with was we bought bulk, the employers bought bulk supplies of tests from local clinics. And then they just send employees in that they thought, either knew somebody that had COVID or that they were symptomatic. So that was the solution then. That actually continues to be a solution today. Then the other solution is beyond just going to the public sites and referring to the public sites, is we're seeing an increase in ag employers that are contracting with vendors to actually come on site and do regular testing. This is a very expensive process, but it is worth it because we can't afford to have our workforce out. We will not be able to get your food on the table without a good workforce. In setting these up, we looked at what the CDC said. So what is the CDC's recommendation for employer-based testing or employer-sponsored testing? And their approaches include initially testing everyone, or periodically testing employees at regular intervals, such as Cal Poly. If you came on the call earlier, Cal Poly actually tests students. They've got a system where they test students twice a week. Or targeting those new or returning workers and making sure that they're getting tested. So this is part of the reason that a lot of employers right now are relying on those vendors that can come in and come on site and test. And then, of course, working with the county and the state to try to make our local public system as accessible as possible and as friendly as possible. And I think you'll see an increase in cooperation to that end after yesterday's supervisor meeting. We'll figure out ways of making it even more friendly than it is. So that's pretty much it on testing. Do you want me to go into the other things as well?
Well, especially you've got a webinar coming up that the public is invited to. I thought you might want to talk about that.
Oh, good. Okay. So I'm not only us that I see, but everybody else on this call I know is on a lot of calls like this or following Twitter. I know you. I run into you in the webosphere. But that is not the way the way we spend our lives is not the way most people spend their lives. And a lot of businesses are pretty confused. It's why we do this advisory. It's why all of the trade associations are regularly sending out information. It's why there are regular webinars. So a lot of people are a lot of employers are very, very, very confused about testing, about vaccinations, about employee education, and my meeting earlier today was about myths. How do we get the word out about myths? So on March 3rd, which is actually the day that vaccinations can begin for those that are exposed in the food and ag sectors, education and early childhood and emergency services, we're going to host a webinar for whomever wants to join. But we're focusing on HR, supervisors, managers, that level really, and answering questions that are very practical. What do I need to do to get my employees registered for vaccinations? Is that even possible? How can I work with the county to make sure I send 30 people over to Soledad's drive-in site? Is that possible? Those kind of very practical questions we're going to do on the ground, going through each of these questions. We also have a website called Monterey Frontline COVID Vaccine.com. And it shows, in addition to this kind of information about vaccinations and testing, it also has a list of resources that a lot of them are provided by the county. A lot of them are provided with a partnership that we all have with the Community Foundation of Monterey County. So it puts everything that employers would need together in one space. And that is also always evolving. And I'm happy to respond to any specific questions, whatever you need, Maya.
Thank you. And then we do want to let all the presenters go and then do questions afterwards. I just want to give you, Supervisor Leo, if you want to have a last word on this.
No, I think we're excited. The only other thing I would say, something that we worked on very cooperatively with ag and labor unions, was getting vaccination to our workers, because we know ultimately that's going to be the key among all the many other steps that we've taken. And tomorrow is our first day at Diorigo Farms, being able to give vaccination for the first few hundred agricultural workers that are 65 and over, in both priority categories, that they work in agriculture and they're also in that high risk age group. But I think there's going to be more coming beyond tomorrow on that topic. But that's exciting because we've worked many different ways, and we're making progress with the state. But under this new federal program with the FQHCs and Clínica del Valle de Salinas, we got some progress that's starting tomorrow, and I think more news will come out of that in the coming weeks.
And it's a great start. I mean, that we're getting started is fantastic. Thank you both. And if you would stay on the line and be available for questions, that would be wonderful. We're going to keep on I know we were just talking about vaccine, but we're going to keep on the testing theme, because it is still important to consider testing, and testing is still really critical to prevent the spread of COVID-19. So joining us on the testing topic is Dr. Caroline Kennedy, who's the Monterey County Clinic Services Medical Director, and hopefully Dr. Ed Moreno can join in on this topic as well, because we want to talk about the fact that even though everybody's head is in the vaccine world, we still have to keep testing for COVID because it's still among us. So Dr. Kennedy, I'm wondering if you could lead us off and talk about what's happening in the county clinics with testing and some of your inventive ways to get people tested.
Sure. Wonderful. So I'm a family physician, and I'm the medical director of our 10 FQHC clinics that we run at the county. We see about 650 people a day throughout our clinics. And I wanted to echo the fact that between the lack of vaccine hesitancy among our patients, and the fact that children are not able to be vaccinated, vaccine isn't going to be the solution, complete solution right away, and that we really need to keep testing. Many of our patients only have mild URI symptoms, which we say upper respiratory, like a cold, and they don't really think they have it, and they just continue their life as usual. So testing and isolation are going to continue to be the cornerstone of what we're going to be able to stop our spread. It is really the only way we're going to be able to make work, school, and the clinic system safe until we have herd immunity, until this virus is no longer among us. So I wanted to admit that we are also experiencing that large decrease in testing. We're testing about 20% of the patients we were testing at the peak, which was for us was in January. Our reasons for testing is mostly exposure at home and work, followed by feeling like you're sick and you have COVID symptoms. It's being required by work, which Kim talked about earlier. It really helps drive patients to get tested, is that their work encourages it or requires it. And some are saying requiring it for travel, and we are also doing a little bit of surveillance testing. So Dr. Moreno is going to speak a little bit about more importance on the public health and epidemiological standpoint, but I'm here just a little bit boots on the ground to tell you what we are able to do at our clinic system to support testing. So we test, we're only open 5 days a week because we're county, but we test those 5 days a week at 3 sites since April. And we choose locations that are really easy to walk to from our patients. If it's in all of our clinics are in high density areas, but we really want to be there to make it convenient for people. They don't have to travel very far out of their neighborhood. We have 2 dedicated providers that open schedules every day to take testing requests. We don't let those fill up with other calls because we still believe that testing is really essential. It's protected time. We test the same day people call in. We test any patient who requests it for any reason. We don't start scrutinizing them. Oh, maybe it wasn't a good exposure. I don't really think your symptoms are any good. I don't think travel is a good reason. We just test anyone so we don't become a barrier. We encourage the entire family to get tested. This week, I had a mom tell me on Sunday she tested positive. We actually had the rest of the family come in the car and get tested, and we had another 3 people in the family test positive. Some would say, well, that family's already positive. Why are you continuing to test them? But we find patients sometimes are calling in and you can hear them at the grocery store, or they're in their car and they're not isolating. And sometimes we want to impress upon the family that it's not just the 1 or 2 people that feel sick in your family, it's the whole family. We don't discriminate between established and new patients, so that same family could refer their grandparents, their uncles, doesn't matter if they're Blue Cross Blue Shield, we will take anybody at that same day and test them. We have rapid antigen testing, which takes 15 minutes, it's free. So we test them with that swab first, and then if it's negative, we send the PCR, but otherwise we can give them that result and they can really change their behavior at that very moment. We do test OB patients and their partners at term. So when you turn 37 weeks pregnant, weekly, we test those patients to make sure we are preparing them for a really healthy delivery. I think it changes behavior when you're being tested. You realize, hey, I'm at high risk. It's very important that when I deliver my baby, I'm not positive. And interestingly enough, from that surveillance, we've found quite a number of OB patients that have no symptoms whatsoever and are testing positive for COVID. We also allow testing during regular office visits. If you come in for hypertension and you need a COVID test, we will just swab you in the room. We don't make you go to another site. And then we are even able to accommodate people who can only come at certain times or happen to walk up to the clinic and are like, I'm here now and I need to be tested. I wanted to mention a little bit about the other really important partner we have in our community, which is Clínica de Salud de Valle de Salinas. I was able to speak with their medical director, Dr. Nohuacha, this week, and they've tested over 32,073 tests with a 25% positivity rate on their website. They are doing more testing than clinic services, and I think they're doing a few amazing things. They have actually early on decided to go to the work site. They actually go to the fields and test people where the people are. Don't make them travel to the clinic. They were at grocery stores. They picked grocery stores where people could walk to easily and opt in. They had community health workers at many of these sites and talking to patients about, yes, if you test positive, we can help you with replacement income. Yes, if you test positive, we can get you alternative housing. I think they also, they have a standing order so that there's no physician required to grant a test. So that's pretty easy. They also went to the homeless gatherings and partnered with people there to do swabbing of the homeless population. So I think that if federally qualified community health centers are doing an amazing job in your community, to overcoming some of the barriers, this new focus on immunization is definitely distracting all of us, and it's no longer people are calling in and asking about testing. There's a little bit of the testing fatigue. I think there's also a lot of denial. Patients have very mild symptoms, and or even when they test positive, they still can't quite believe it's COVID. So I think the message that COVID could just be a small headache and the stuffy nose and a little bit being tired. As I mentioned, loss of income in no way to isolate can sometimes be a little bit of a barrier, but I think we've been doing a good job of letting people know that there are alternatives. The ag community last year, in my opinion, did an amazing job of providing people with housing. Often patients would call and say, I'm having a fever, and I'd say, where are you staying? And they say, well, ag already put me up in a hotel. So I think some of those things were really innovative, and I'm very proud that our community was able to do that. So I like to think that as a physician, I influence a lot of people, but I really am realizing that journalists and media have a huge impact on our community. And I have found your reporting to be medically sound, scientifically sound, and I wanted to thank you for all that you have done. I know it's a repetitive message about testing and isolation, but they are cornerstones, and it's just essential for us to get out of this pandemic. Thank you.
Thank you, Dr. Kennedy. And then Dr. Moreno, you were going to join in and talk about some of the more medical or technological terms for testing.
Hey, Mia. Thank you, Dr. Kennedy. It's good to be here. Well, I think I was just going to talk a little bit of the importance of testing, but Dr. Kennedy did a really good job there. Basically, I agree with her. It helps us to identify individuals who are infectious so that they can isolate and not infect other people. So it helps to reduce the transmission of COVID-19 at home. If someone knows they've got COVID-19, they can take measures to stay away from other people in the home that don't have symptoms of COVID-19, so they don't, hopefully don't spread it to other people in the household. And also people that know that they have to stay home from work or from school so they don't transmit it to other people. It's still a very serious illness, as Dr. Kennedy said. It's not, for some people, it's not just a headache or runny nose or a cough. It's a debilitating disease that leaves people with months and months of shortness of breath, fatigue, weight loss, aches and pains, recurring headaches. Some people it just goes on and on and on. So it is not a benign illness, and we still have people unfortunately dying from COVID-19. So every case that we every case that we can prevent is potentially a case a life saved. So it also we do have, as Dr. Kennedy mentioned, we do still have alternative housing program in place to assist people who can't isolate safely at home or where they're currently living, giving them a place to stay during their isolation period. And if they need support, either at home or at an alternative care site, such as food support, legal advice, social service supports, replacement income, we can still provide that to them, make sure that they get that direct, get hooked up with those organizations that can assist. But there's other reasons why we want to continue to have people test. And it provides, for example, provides us valuable information about our case rate and positivity rates here in Monterey County, which is an indicator of transmission. And that's still important information that we need here locally to continue to make decisions. And the state is relying on those results to make decisions as to how restrictive businesses and schools and other sectors need to be in Monterey County. So we do need to have that information as well. It can also help us to continue to check for locally circulating viruses to see what variants are present. And we do know from genotyping here in our own public health laboratory that the L452R variant is here now in Monterey County. It was detected in the United States in July 2020. There's over 800 cases in California, and we have at least 33 cases here in Monterey County now. And just looking at there were small numbers, but the numbers of looking at the specimens that we were able to test for variants, we found that up to 70% of the specimens that we tested were of the L452R variant. And so this is very important information because we know it's here. And just recently, Dr. Chu with UCSF announced some of his findings on the genotyping findings that he had. And he, based on his studies, he believes that this variant is more infectious, and he has some evidence to suggest that it's more associated with severe illness, and it is partially resistant to neutralizing antibodies, which means that those people who've been infected with COVID from the virus that, of the dominant strain or have been vaccinated may not have as much immunity to this variant compared to the dominant strain. So this is really important information that we get from people who continue to get tested here in Monterey County to give us more information on what's going on with this pandemic and how the dominant strain and the variants might possibly impact Monterey County and its residents. So again, testing, I agree with Dr. Kennedy, testing is still very important. It provides valuable information for individuals to protect them, their loved ones and their coworkers, and provides valuable information for the community as we can gather more information and track this pandemic. So thanks, ma'am.
Thank you. And then Dr. Kennedy, did you want to add anything to that?
No, I do. I did not speak much about the chronic long haulers, but it is devastating for me. I have patients that are on oxygen for months after they've had COVID, even if they weren't on a ventilator. And then it affects your central nervous system. It makes you have, your memory is not so good. It affects people psychologically. It can affect your heart, clearly your lungs. And sometimes I'm trying to convince people to get vaccinated now. And I'm like, your two options are, would you prefer to get COVID, which could damage you, and up to 30% of people don't feel right even 14 days later, or would you like to receive the vaccine? From my standpoint, it is still a terrifying, even if it doesn't put you in the hospital, it is still terrifying to me to think that it could make me feel fatigued and I wouldn't be able to take a walk or do anything else. So it is, that's why at our location, I think 95% of our healthcare, our physicians all asked to be vaccinated. This long-term effects of this, even in mild cases, can be really devastating.
Thank you for that. And then thank you both. And then Dr. Moreno will be circling back with you after our next presenter for a general COVID update. And now we're going to move on to something from our behavioral health, the Behavioral Health Division of, or Bureau of the Monterey County Health Department. The Behavioral Health Bureau is working on a 10-year regional ending homeless plan, and there is a series of community input sessions that are going to be happening, and we've got Michael Listman and Roxanne Wilson here to talk about those sessions and then the importance of the plan that you're working on. Good afternoon.
Good afternoon, Maya. Thank you very much. As many people may know, Monterey County and San Benito County have been working on the issue of homelessness for many years through its Continuum of Care Council and primarily through the Coalition of Homeless Services Providers. And of course, the issue of homelessness and preventing homelessness has been severely impacted by the crisis of COVID and the high cost of housing within our region. In 2011, an initial Lead Me Home regional plan, 10-year plan to end homelessness was created. And in 2019, it was updated. And but as we did the update, we recognized that there were significant areas that needed to be improved and focused on. And Roxanne Wilson is the executive director of the Coalition of Homeless Services Providers, and they're actually the ones that are facilitating this plan. We are the Behavioral Health and Health Department, the County of Monterey and San Benito are part of the sort of the coalition of support to the update of the plan. But really, Roxanne is coordinating that plan. So I'll turn it over to her right now to tell you more about the input sessions.
Yeah, so this I do want to just focus on the fact that this is a big partnership. It's a huge effort because we do have the City of Salinas, the County of Monterey, several departments from the County of Monterey, the County of San Benito, and the Coalition all working together on rewriting this plan under the direction of the Leadership Council, which is the Continuum of Care governing board. We had identified focus strategies as the consultant because they use local data to inform strategic system rebuilds with a major focus on housing, equity, and person-centered solutions to reduce homelessness. The Continuum of Care, as Michael said, we have been working on this for quite some time at this point, and we have completed the first 2 phases of the plan, which included an assessment of the current inventory, program performance, cost per positive housing outcomes, projections, and interviews with service providers and systems leaders. We're now at the stage of asking the rest of the community stakeholders to join us in the conversation and discuss their concerns or submit ideas through the community input sessions. There are 4 remaining input sessions that are scheduled. The first one is tomorrow, Thursday, February 25th, where we will be discussing emergency shelters. We will also have another one on Thursday, March the 4th, where we'll be discussing housing solutions. And March 12th is homeless prevention, and on March 19th, we're talking about regional governance. In addition, there's going to be 2 evening town halls, both in English and in Spanish. Those dates are still being finalized, but we can expect the meetings to land somewhere near the middle of March. To access the links to the meetings or to learn more about all of the work that is being put into this plan rewrite, people can visit our website, chsp.org/plan-rewrite, or visit the Coalition's Facebook page. All of this is Googleable, and you could also just email us at info@chsp.org. I also want to throw in there, homelessness is such a huge conversation throughout the state of California. This is not just a Monterey County, San Benito County problem. If anybody is interested in learning more about what's going on in the homeless sector and all of the work that the Leadership Council and all of our stakeholders are putting into the efforts to end homelessness, I do invite people to watch the Leadership Council meetings. You can request to be added to the distribution list for the Leadership Council by, again, emailing us at info@chsp.org. And that's all I have to add.
Thank you, Roxanne, and thank you for that pretty thorough information. Before we move on to Dr. Moreno, Michael, is there anything you'd like to add?
No, I think Roxanne did a fabulous job updating everyone on the plan, and obviously there's much more that's happening within the community, in both in Salinas and throughout all of our municipalities in Monterey County, as well as San Benito, to try to address homelessness and help people get housed, and to prevent homelessness within our community. Thank you.
And Roxanne was kind enough to send a flyer that has all of the input session dates and information, and that will go out to all of our media partners right after the briefing. And then, so thank you both very much. If you would stay on the call for any questions that our reporters might have. And now we turn back to Dr. Moreno, who's going to give us a COVID update. A lot has happened, as usual, this week in COVID, especially at the state level.
All right. Hi, Maya. Okay, so one moment, please.
Sure.
Okay. All right, ma'am. So just for this week, my update includes a little bit of information about our data. As of Tuesday of this week, our adjusted case rate is 18.4 per 100,000 people. And our test positivity rate is 6.6% countywide. And it's 12.7% for our health places index communities. So based on the blueprint guidance, the state continues to assign Monterey County to the purple tier. Based on the data, there's an impact to schools, and that is that when the case rate in California drops below the 25 per 100,000 people, which it has in Monterey County, then schools that are open can remain open for transitional K through 6th grade, but they have to post a COVID-19 safety plan, which includes the school guidance checklist and a COVID-19 prevention plan. So there's two parts of their safety plan. So they essentially have to post that on their website, and then they can remain open. But for schools that aren't open, they can reopen now that the threshold's been met. And they too have to post their COVID-19 safety plans to the website, but they also submit their safety plans to the local health department and to the state. And so the local health department or state, once it's submitted, can object to their opening or make recommendations to the school on their plans within 7 days, and the schools must address that. If there's no objection or no recommendations provided to the school within 7 days, then the schools can go ahead and reopen. So there is, though, a 3-week window that the state has announced, and that 3-week window takes effect the day after the state has reported that this county case rate has dropped below 25, and that occurred for us on February 16th. So for the 3 weeks following February 16th, schools that were closed and have posted and submitted their safety plans, they have 3 weeks to open, regardless of what happens to the case rate. So even if the case rate this week or next week were to jump up to 25, above 25, we're still in a 3-week window, which means the schools can still reopen if the case rate drops above 25. If after 3 weeks, the case rate is above 25 and a school didn't reopen during those 3 weeks, the school, if they want to reopen, will have to wait until the case rate drops below 25 again. So that's important, and that's all on the state's website. The case rates also have an impact on now the youth and adult recreational sports. So on February 19th, the state issued guidance for youth sports and adult recreational sports, and it takes effect February 26th. And it applies to organized youth sports and recreational sports. So that includes youth sports that are organized by schools, organized in the community, or organized by private organizations, and also adult recreational sports. So for Monterey County, we have a case rate of 18.4, which is above the state's threshold of 14. But our case rate is dropping. For a county that's in a purple tier, whose case rate drops below 14, the organizers of youth sports and adult recreational sports can begin to implement outdoor high contact sports, which is considered the orange tier activities. And those can be played in the purple tier under certain conditions. And this is all on the state's website on their guidance, but essentially it involves informed consent, meaning that the participants, the individuals or the custodian, guardians or parents of the kids understand what the risk is of participating in high contact sports face-to-face with someone who's not from your household. There's also a testing requirement prior to competitions, and there's also a requirement for face coverings, physical distance, testing that I mentioned, hygiene, sanitation, and some limitations on mixing by participants and travel considerations. In addition, when the case rate drops below 14, counties in purple tier can then begin to participate in organized outdoor moderate contact sports under certain conditions. And there aren't as many conditions for moderate contact sports. And so that still includes informed consent, face covering, physical distancing, hygiene and sanitation, limitations on mixing participants, and travel considerations. So those are all, we anticipate that will be, for Monterey County, we probably will be in those circumstances fairly soon. Hopefully if things continue to go well and transmission continues to decrease. So that's my update on the data here in Monterey County and how it impacts what can and cannot be done and under what restrictions for the blueprint, our tier status for schools, reopening, and for youth and adult recreational sports. Moving on to vaccine, we know that the third-party administrator continues discussions with local health departments and the state. And we do have some health officer and health director representatives in those discussions at the state level. This week, we were told by the state that this week is the first week that the third-party administrator, Blue Shield, will be determining allocations for counties. So we were told that the state will continue to determine the allocations, but we were told that the third-party administrator has reviewed the amount of vaccine that's being made available to California and has made what sounds like a recommendation for allocations to each county. Those allocations were submitted to the California Department of Public Health, and the California Department of Public Health are looking at the allocations that the third-party administrator has made for each of our counties. I don't know how much we're getting next week or this week in our allocation, but overall, the state shared that just over 819,000 vaccines will be allocated to counties, which is a nearly the level or slight increase over last week's allocations. For now, Monterey County Health will continue to review and approve vaccine orders from our local vaccine providers with an emphasis on approving orders that get vaccine to those providers that can vaccinate the priority populations here in Monterey County. As far as transitioning to the third-party administrator, March 7th, for now, March 7th is still the target date for Monterey County to transition to the third-party administrator. And as such, if things go according to plan, Monterey County and the other vaccine providers in Monterey County would become part of the state's network of vaccine providers. And then as a reminder of who's eligible to get vaccinated here in Monterey County, currently it's individuals that are 75 and older, individuals who are 65 to 74 who are at risk of exposure in the sectors of healthcare, food, agriculture, childcare, education, and emergency services, and those that are 65 to 74 who are living in the Healthy Places Index zip codes. And that information, again, is on our website. The zip codes and the sectors are all there on our website. On March 17th, the following individuals will be eligible to receive vaccine in Monterey County. It'll be everyone 65 and older. It'll be people 16 to 64 who are at risk of exposure in healthcare, food, ag, childcare, education, and emergency services, and people who are 16 to 64 who have underlying medical conditions as determined by the California Department of Public Health and confirmed by local healthcare providers. So that's my update, Maya, and I'll do my best to answer any questions if there are any.
Thank you, Dr. Moreno, and thanks everyone for your presentations. We do already have questions in the chat, and I'm going to go ahead and read them for those who are not in the chat and can't read the questions. So, Dr. Moreno, we'll start with you. This is regarding the Johnson & Johnson vaccine. What do you know about its reported effectiveness, and how much could its presence ramp up our supply in Monterey County?
So, unfortunately, I haven't had a chance to read the emergency use authorization issued by the FDA, but I'll be looking at that to see what the efficacy is and how the trials were conducted and what the trial results showed that backs up the FDA's authorization. In terms of how it would, but what I have read in the bit of time I've had to look at it is that the single dose is as part of the authorization is considered effective in imparting adequate immunity to the recipient. In terms of what it can do for our efforts to vaccinate, I think that as we introduce, I think on the positive side, I think definitely should have more vaccine available to give to our vaccine providers so they have additional opportunities to vaccinate our community, which will get more people immune, which means that transmission should continue to decrease, which is essential for us to be able to go out and do more things, still with some restrictions, but fewer restrictions for Monterey County, but most importantly, fewer illnesses, fewer hospitalizations, fewer people living with the long-term impacts of COVID and fewer people dying. I think that we'll probably need to see if the California Department of Public Health, with or without guidance from the Centers for Disease Control and Prevention, issue particular recommendations to vaccine providers on whether or not there are particular target populations where this vaccine might be more appropriate rather than the current vaccine that we have. So that's something that we may be getting. We'll have to wait and see if CDPH is going to issue those type of guidance documents. Thanks.
Thank you. And then another question for you. Did the county get its shipment of vaccines that were delayed by bad weather last week? And if so, has the county started to vaccinate people in the updated eligibility tier that was scheduled to begin on February 17th? I think perhaps is there a relationship between perhaps any delay in vaccine in delaying vaccinations for newly eligible residents?
So I can only speak for our public health bureau. We did not schedule any clinics or confirm any appointments that we did not have a vaccine available to vaccinate. So even though there was a delay in the shipment of our vaccine, which we did get this week, we didn't have to cancel any appointments for anyone. And yes, we have since February 17th, we have had some vaccine clinics. So we are focusing on the new eligible groups.
Right, thank you. And then this is a question related to the farm worker vaccination clinic in Salinas tomorrow. Is the clinic happening at Dorrigo, California in Salinas tomorrow part of the health center COVID-19 vaccine program by the CDC and the Health Resources and Services Administration? How many doses of vaccine will be supplied by the federal government for this effort? And does the number of vaccine for this program count against the county's allotment?
Okay, so Maya, I think that's, and Dr. Kenny here too, who's recently spoke with Clinic. I think they're talking about the partnership with the Grower and Shipper Association.
Yes.
Yeah, so I don't know which vaccine allocation is going to be used for that. I suspect it's probably going to be the allocation that was approved through the countywide allocation. So and that's because the clinic was postponed because of delay in shipping, and the delays in shipping occurred in the doses that were approved by the health department to Clinica and Dr. Kennedy's offices and other offices. So it may be that that's the vaccine they use. What I do want to add, though, that I didn't mention already, Maya, is that the state has moved on to a dose is a dose. And with that, we had previous, and that's a term that they're using. So I'll use it. Up until a week or two ago, the state was issuing on a weekly basis either first doses or second doses or first and second doses. And when they issued a first dose, 3 to 4 weeks later, the state would send out the appropriate number of second doses so that second doses could be administered. The state is now, they're still sending out allocations and distributions to our vaccine providers, but they're leaving it up now to the providers to keep track of all the doses they have in inventory. And they are transitioning the responsibility of identifying first and second doses to the local vaccine providers who have done this before. They do that with vaccines that require more than one dose, like measles, mumps, rubella requires 2 doses, for example. And when a local vaccine provider orders vaccine for measles, mumps, rubella vaccine, they don't make an order for first dose and order for second dose. They just make one order, and they keep track of how many they've administered and how many second doses they need in inventory to vaccinate. So getting back to the question, whether or not the clinic coming up uses county first dose, county second dose, or federal allocations, it's really up to they'll be up to Clinic of the Salud to keep track of the vaccines that they received to make sure that whenever there's a first dose, they have enough for a second dose. In terms of the federal allocation and its impact on the county allocation, what we've been told is that the federal allocations do not take local allocations from the state away. So far we've seen that when the federal allocations were given to CVS and Walgreens so they can vaccinate the skilled nursing facility staff and their residents, we did not see notice a reduction in allocations that were coming to us in Monterey County. Similarly, now that recently CVS is receiving vaccine directly to vaccinate people at their retail stores, we did not see a reduction in our allocations either. And most recently, now that Clinic of the Salud has already received 1,000 doses, we did not see last week, or we don't anticipate seeing this week, a reduction in allocation. So it appears that thus far, as more organizations in Monterey County begin to receive greater numbers of federally allocated vaccine, it doesn't seem to be affecting our county allocation.
Thank you. And then I have a question for you regarding vaccine distribution data. When looking at the numbers, there seems to be a disparity in the percentage of people vaccinated in the Peninsula and Big Sur areas versus Salinas and South County. Why is that, and what is being done, or what has to be done to address the disparity?
Thanks, Mia. So we have been tracking this information and putting this information out publicly. And what we do know is that up until just recently, those individuals that were being vaccinated were healthcare workers and people over the age of 65. And we do know that we suspect, but we don't have information from the state, that a lot of some of the demographics of the people who have been vaccinated thus far reflects the demographics of healthcare workers. And so whatever that demographic is probably having an impact on the demographics of those being vaccinated. As we move into those that are 65 and older, that adds a group of people who aren't, whose demographics aren't dependent upon where they work or what sector they work in. And so we've been posting the 75 and older, now posting 65 and older. And in those populations, we do see that there are some disparities that has nothing to do with where they work. It's less on where they work. And so we do see some disparities where there are certain communities who are getting a greater proportion of vaccine compared to other communities and certain populations. So we do see that there are a greater proportion of individuals in certain peninsula communities who are overrepresented among those getting vaccinated. And we do see that there are some individuals in South County and Salinas who are underrepresented. We also, and that's just by looking at region. We also look at, and we are looking, getting more familiar with the state's information portal to see if we can get some reliable information that's in more detail, specifically looking at zip code level, which we also want to see as well. And we look forward to sharing that hopefully soon. But then there's also the race ethnicity information that we do have, and among those that individuals that were vaccinated that we do have race ethnicity, we do see among 65 to 74 and 75 and older that among certain populations like the Latino Hispanic population, they are underrepresented among those that are vaccinated thus far in Monterey County. So what we're trying to do in terms of the strategies to try to get individuals, a certain age group and individuals that are in certain sectors, priority sectors vaccinated, is to get vaccine to those vaccine providers that have historically had, who have a history of getting a vaccine, providing healthcare services and vaccines such as flu vaccine to those populations that have been hardest hit by COVID-19 and are, according to our initial data, seem to be underrepresented among those that are vaccinated. So that would include healthcare providers that provide care to the older populations, and that happens to include Dr. Kennedy's Federally Qualified Health Center, Clinics of Soledad Medical Group, and the clinics associated with 4 hospitals. They provide service healthcare to a large number of people in the older age group. And so they are looking through their healthcare records and calling people, inviting them to come in the older age group, inviting them to come in and get vaccinated. And we're also getting vaccine specifically to, among all of those, getting vaccine to certain providers who also have a long history of providing healthcare to the Latino population and also the farm working population. So our vaccine providers, we're making sure that we're approving orders to get vaccine over to Clínica de Salud, over to the county clinics, in East Salinas, Soledad Medical Group, United Ag, and Me Memorial Hospital clinics, so that we can get vaccine to them so that they can, again, look through their rosters, make some phone calls, and get people in to get vaccinated. So hopefully we can get a little more, try to work toward a little more equity in the distribution or administration of vaccine here in Monterey County.
Thank you, Dr. Moreno. Another question for you. This is on the safer economy, the blueprint for safer economy. 5 counties this week moved into a less restrictive tier in the blueprint for a safer economy. Governor Newsom said 8 more counties are likely to move next week and even more the following. Looking at the data, could Monterey County be moving into a less restrictive tier anytime soon?
Thank you, Mia. I hope that Monterey County, we as a community continue to do what we need to do by to reduce transmission, and that's how we're going to get eventually to a less restrictive tier. And in terms of when I think we're going to get there, I don't know when we're going to get there. I just know that we need to, if we're going to get there, the only way we're going to get there is for people to continue to wear the face coverings, continue to stay home as much as they can, avoid group gatherings, and wash your hands, and get tested if you're exposed or feel sick, and isolate. And if you need help isolating, the county and other nonprofit organizations are available to help people isolate. That's how we're going to get there. So it's very important that we do that.
Thank you. And then another question, just going back to the Johnson & Johnson vaccine. If J&J receives the emergency use authorization, how soon could Monterey County actually start to see vaccine arrive?
We just had a call with the state today regarding the third-party administrator and allocations. And during that call, there wasn't any indication from the state as to when they thought California and Monterey County and other counties would be getting vaccine.
Thank you. And then I'm trying to squeeze in a couple more questions here. What is the cause for the rapid decline of COVID infections in Monterey County?
I think it's. I think when we look at the epidemiologic curve and we apply the events that have occurred over that period of time, we see that there were a lot of traditional holidays that result in a lot of gatherings, travel and gatherings that occurred during the upswing of the pandemic surge, the second surge. So we had Thanksgiving, Halloween. I think we had a national holiday in there. We had Christmas week. We had New Year's. A lot of traveling, a lot of people gathering with mixing with other households that contributed to an increase in cases. We are out of that concentration of holiday traditional events. And so I think that has contributed to a decrease in the case rates. I haven't seen any evidence yet from major researchers here in the US, but I'm hopeful that the ability to vaccinate individuals here has also contributed to the decrease in cases. And we have quite a few people who've been vaccinated here in Monterey County. I think it's about almost 50,000 people who've been vaccinated, or excuse me, not vaccinated. We have 50,000 doses that have been administered here in Monterey County. So I'm hopeful that that's contributed, and I hope that hopefully soon either the state or some of our major research institutions might be able to provide some information as to the contribution of vaccinations on our epidemiologic curve.
Thank you. And then one last question, just to wrap up the youth and adult recreation issue. Will youth and adult recreation leagues have to shut down if cases go back up above the 14 per 100,000 threshold?
Oh man, that's an excellent question. I don't know. I'll have to check. Thank you.
All right. Thank you. And I think that's really all the time we've got for questions. We're right at the 1 o'clock hour. If there are any additional questions, I will forward them for response for those who asked. Thanks everyone for being on the briefing today. And our next briefing is next week. We'll see you then.
Thanks, ma'am.
Thank you. Good afternoon.